Good evening, everyone. My name's Nina Hartley. I'm representing the South Wales and West of England branch, particularly the Devon and Cornwall chapter tonight. Today, we're quite fortunate that we have Alan McCoy with us to talk about Torbay Council. During the introductions part, we'll be doing a little bit of a Slido, so thank you for everybody who's already responding. If you want to join in, there is the QR code on site, or you can join in through the website using the hashtag that is on screen. It's just a bit of fun to see who's in the room and find out where everybody's from, so I'd like to see a nice mixture of people. During tonight, there will also be an opportunity to ask questions via the chat function. So please feel free to post anything, and I'm sure Alan will be happy to pick those up at the end of the presentation. The other things that we'll be doing is some house notices. So onto that side of things. You will be on mute for the presentation, but as I say, we can use the chat function. If you do have any technical issues, please also use that chat function, and we've got Rob supporting us tonight from APM, who will be happy to help you out. In terms of the event itself, we're always looking to try and improve the presentations, learn lessons in a true project management style, and also get your ideas and suggestions for topics. So after the event, you'll receive an evaluation form. Please fill them in. They are really important for us to keep the programme going. In terms of what's going on in APM, some quite exciting things. Obviously, we're not doing any physical events until November at the earliest because of COVID and the lockdown restrictions. However, we are working up some nice, interesting topics for you to dial into online. And we'll also be looking to hopefully get back into the real life meetings soon. So upcoming, we've got on the 7th of October, a virtual networking event, which is called Empowering Young Professionals. The idea there is to bring people together from different parts of their career to share experiences and to help shape the future of project management. That's followed up on the 12th to the 13th of October with the chapter's project management conference, the project team of the future. We're also looking early November to have a talk about defence equipment and support project management transformation. And then on the 23rd of November, we've got the benefits of collaboration for project success, presented by David Hawkins from the Institute of Collaborative Working. Other things excuse me. Other things happening from APM. Our chartered project professional is going from strength to strength with over 2,000 successful applicants to date. And there are various webinars for those of you that are interested in joining and becoming chartered. So have a look on the APM hub and in the events notice boards. So without further ado, I'd like to introduce Alan from Torbay Health Authorities to talk about his experiences over the past year. Thank you, Alan.
Thanks, Nina. Good evening, everybody. Thanks for your time. Really appreciate it. I know everybody's very busy. So, my name is Alan McCoy. I currently work as the Programme Manager for the COVID Prevention and Response team at Torbay Council down in South West. I have been in sort of delivery, programme management, portfolio management, project management, any other kind of management roles over the majority of my career, spanning industries such as food manufacturing, telecommunications, insurance, environmental services, and now I took a step outside of my usual IT roles and IT-based roles to work in public health. So I originally from the southwest of England, and I grew up in Torbay. So the area of which I'm working in now is really dear to my heart. My family all live in the area. So working at Torbay Council there's been an interesting experience, especially in the response to COVID, and how we've been managing our program and responding to that. So hopefully it will be of interest to you. Like I say, I want to make sure that your time is well invested. So basically what I'm going to cover is what governance was put in place from a program management perspective. How did we coordinate the program around other things that were happening in the council at the same time as well? Because obviously COVID being a front and centre kind of issue wasn't the only thing that was going on as well. One of the things that I will touch on, and you'll probably get a theme here, the changing landscape and policy changes, etc., and how we've managed to incorporate those in what we're doing. And what does a little bit of the future look like? It's not a crystal ball exercise, but how are we moving into the next kind of phase with our program and our response to COVID. So I joined the team in public health in October of last year, and I was very lucky in the fact that that director of public health at that time had realised that obviously the response and the team in public health had been working since probably Christmas, when first reports were starting to emerge of COVID coming out of various countries and landing in the UK. So at that time in the public health team, there were two individuals. So there was a director of public health and a public health consultant. As we sit here today, we're about a team of 23, 24, which ranges through public health consultants, director of public health, advanced health practitioners, local enhanced contact tracers. I'm running the program management aspect, and I have a project manager working for me, but we kind of divvy up things as we need to. So basically I walked into a written report from the director of public health at the time saying, and looking at the diagram, it says 50-50. I would say that was 90-10 in expert knowledge and skill, really heavy, good guidance on outbreaks, good links in with various work streams and other organizations. But from a structure and a process perspective and an overall governance, it was very light on. There was no clear roles and responsibilities. The decision-making process was very ad hoc, and this is not a criticism in any way, because the team have done an amazing job and were doing an amazing job, but you can only scale so far if you don't have things that help with consistency and being clear. So there was a lot of work already done and identified, but what I helped do was the analysis of what needed to be done. So we needed clear roles and responsibilities. We needed so it mentions on the slide there, the SOP and action cards. They're standard operating procedures that the team can help with organisations and different settings run through what they need to do from a risk perspective. There was no real overview of what the programme was meant to do. It was just help us respond and prevent COVID. That was basically it. And everybody working full hands to the pump to get that done, but there was no real structure behind it. Communications was in flight, but obviously there was a lot of communications coming around from central government, local authorities. One of the really good things is in the Southwest, we work at a regional level with Cornwall, Isles of Scilly and Devon. So there were good communications, and stakeholder management was, in progress. There was some stuff happening, wasn't particularly organised or targeted. One of the main things was around resilience in the team. Obviously everybody working, incredibly long hours, really stressful, dealing with things that, in normal day-to-day roles you don't get an insight into. fatalities and working with care homes and, cases going through the roof. So one of the things I sat down and kind of went through with the team, which was a really interesting exercise actually, because how do you get information from people who are really busy? You have to take their time to do some stuff. So we did a SWOT analysis with the team in a session, and it was very much done at pace. And you'll hear me say that a little bit through this presentation, because that's exactly what needed to happen. One of the other things I looked at as well was the program management structure to the meetings, what was covered, the scope of those meetings, timings, sequencing. We needed to realign some of the meetings so there was a natural flow of decision making and information flowing. So there was a lot of work gone into that, and really sort of taking a step back, of which I had the luxury to do, to look from a program management perspective and say, these are the elements I think we need to use. Now it sounds incredibly easy, but you take your book and you do your training and you bring your previous experience along, but it's only when you really get into a role and you start to understand what is and isn't required, and how you can start adding some value to what the team are doing. So I always felt like I was kind of supporting the team and trying to make their lives easier effectively. So this gives you just an idea of some of the scope and the work streams we're working with. So it speaks for itself around cases and outbreaks and trends across all sectors, including the care sector. We have great links with our education leads through early years through to college. We work very closely with our local NHS trust and the Torbay Hospital. And because we are seeing cases and the data in advance, we can help plan and help warn what could be coming towards the local NHS trust. So when we've talked about waves and things like that, it's around, okay, well, what does that actually mean? And we provided meaningful data to help with that. So one of the things that we have done is pulled a lot of people into our public health kind of family to help us manage those messages, so they're effectively part of our team. So we have an assistant director at Torbay Hospital. She comes to our meetings on a Tuesday, where all the work streams present where they're at, and we make decisions based on that. The same for communications and engagement, obviously really key. Lots of information coming from central government, from the Department of Health and Social Care, Department of Education, the NHS, and trying to form that into a package that we can then provide information to our residents and visitors. Bearing in mind Torbay, over the summer holidays, big tourist hotspot, not too much travel abroad, so we were very conscious of how we would help with visitors as well as residents. I've highlighted their testing, because testing has been probably the most dynamic, constantly changing beast that we've had to deal with. So we put some framework, a program management framework in place, where we had engagement with procurement, for example, we had engagement with finance, and we set up some mechanisms where we could call on waivers from procurement to engage with suppliers, or we could call on pots of money that were being given to the authority, where we didn't have to go through the complete set of checks and balances. It was a cut down version done at pace effectively. So one of the things was, how do we implement a framework where we can enable testing to happen, but also make sure that we're providing value for money and having those decisions recorded. So we've put in I put in a structure where we track our information, all our decision points are recorded. We provide financial information not only to our own organisation and the wider council each week, but also to the Department of Health and Social Care and others on a weekly basis to look at our testing in specifically for testing, because it's been so changeable. We needed a framework to operate within and have that agility within, and have that autonomy to make decisions based on the numbers that we were seeing. Obviously, higher risk settings and enforcement. So we have a team. I say a team, it's 1.5 people who work with our nighttime economy. Obviously, in the last few months, Torbay being a tourist hotspot, and lots of businesses have either closed or, reopened slowly, and then we're seeing lots of numbers out on streets at night. I think, although the football was fantastic from a perspective of feel good factor, quite a lot of people were transmitting COVID outside of pubs and stuff. So we've worked really hard with our settings and enforcement, and we have a process where they can come back to us, and we help with their risk assessments and all this stuff. All these documents are in place. We engage with those stakeholders we go through, and I've got a slide in a minute where I'll talk a little bit more detail about that. So the vaccination rollout, again, we're heavily involved in that, but that is run by the NHS and the Clinical Commissioning Service. So we have provided within Torbay the Riviera Centre, which is a big sports and entertainment area, and we've provided the space, and the vaccination rollout team have used that space. They use some of our staff and some of our processes, and we've been helping facilitate that. Local enhanced contact tracing. So nationally, this is conducted as well when you get calls from the national call centre asking you about, have you isolated? Where are your contacts? One of the data-driven stuff that we saw was the fact that people didn't respond as warmly to a national withheld number. It was an 01803, which is a Torbay number, which we tended to get a little bit more of a response, where people would engage with us, and we could help do that second and third level kind of contact tracing, which really added value to help stop the transmission of the disease. We work closely with our infection control partners in Devon, and they provide us with some information and some guidance and the latest policies. And all this information has to go somewhere. It felt at the start that it was very, it was emails to certain people, and some people would be left out of the loop. So it's really, my role was about providing that consistency. Where do we go for this kind of information? Where's the latest sort of policy on isolation? Where's the latest policy on this? How do we store that? And one of the things that was a big issue was around the filing system, and I'll touch on that in a moment. A lot of the stuff we've tried to implement has been data-driven knowledge. We have a knowledge and intelligence team. They gave us all the numbers about trends, fatalities, hospital numbers, etc. So we use that real time to try and drive a lot of the decisions we're making. So obviously, after being in the organisation for a couple of weeks, I would have liked a bit longer, but there was definitely, and this is just a very simple slide that I presented to the Director of Public Health and some of the consultants to say, look, we've got a little bit of a listening assessment phase here. This is the plan of how we're going to do it. And it wasn't quite as clear cut as this. There were some things that were started, like I mentioned, around the filing system. So it was a bit of a perfect storm, but during this, the council rolled out Microsoft Teams and SharePoint. So during complex, very busy time, we were then also having to learn and transform the way we work from one system to another. And I cannot tell you how challenging that was when public health and this, I'm kind of fortunate because I come from a technology background, whereas a lot of the people who work in the public health team don't have a technology background. So I've spent a lot of time actually with the project manager I'm working with, who also has a technology background, helping developing what we're doing from communications pages and and all that kind of stuff, transforming the way we work, and then also embedding what we're doing and the way we're doing things differently, like I mentioned, around the structure to our program, and continuous improvement. One of the things that wasn't really happening was there was no kind of governance around business cases. So we were just, or the team were just doing things, but we've implemented a light touch business process approvals. There are lots of other approval processes within the council, obviously. It's a big organisation, but the public health team had never really had to work at that kind of pace. The public health team is kind of split into two areas. One is commissioning services, so those are longer term projects, and I'll talk about those in a moment. And they go through a wider council governance structure for finances, benefits, risk, all that stuff. And we've used a cut down version to help with expediting some of the things that our program needs to achieve in our kind of delivery. So that was very basic. This is for my kind of director of public health. This is what to expect over the next few months, and we've done subsequent things around. We're a bit more embedded now. We've got some more people in the team. Although some of the things are still moving at pace, as I'm sure you've seen, some of the other things are moving a little bit slower time, so we've got more time to add more governance to it. The next slide talks about the different programs that we've got at the moment. So I'm responsible for the Track, Trace and Contain COVID-19 program. There is also another program to the side of that in the green, which is the COVID Outbreak Management Fund, which is a pot of money effectively, and projects which are coming out of it, which go for, it can be very short, supplying technology and laptops to schools, for example, but that can also be commissioning service for sexual health, various things that go for a long time. And we had to set up a mechanism of where the COVID Track and Trace program could link into the comp funding to be able to work effectively and enable us to have the autonomy with a financial understanding that we were covered. We've obviously gone through a lot of the kind of the procurement and the finance checks and balances along the way. We haven't sort of just ignored that. We've been very conscious of that, and that's what I mentioned about bringing the people into the team to really help us. So this dartboard effectively is something I've used. There are sets of questions for each phase that I've used in the past. I remember when I was interviewing for this role, it was kind of like, well, what phase do you think you're in? And some of it was like, well, we're in this phase. We're definitely delivering here, but we're just defining here. So I've used this to try and bring together some of the thinking. And going round from sort of 7, 8 o'clock, the finance and stuff. So my role was about understanding what the total budget is. What are our cost codes? What is the pot? What are the pots we're pulling from? How do we get approvals for that? What are what does the budget look like totally for the rest of this financial year and up to March 23? Where is our staff? Where do our staff costs go? Can we move our costs around to try and maximise, getting people in the team to help us deal with the amount of cases that we were seeing? So there's a ring fence grant that is not touched by us, but we understand the budget within that. And again, it mentions around the COVID Outbreak Management Fund, there is a framework that I've put together that we can use to justify dipping into the COVID outbreak management fund where appropriate, and it goes through a governance structure like that. So risk and opportunities is really interesting, actually, because the council have a risk management structure. So it was around how do we as a program fit within that. We use all the same templates and thinking and guidance behind that. So we've really not reinvented any wheels. We've just made it appropriate for what we're doing. And that's how we've been working. In the first few weeks, I spoke to the transformation team and the wider incident management group and the business change owners, and what we were doing as an organisation to work out what we need to do to make sure we're managing risks in a consistent fashion. Again, what are we doing to mitigate those risks? We might identify something that's coming straight out of our COVID track, trace and contain, but that might be cross-cutting. So how do we fit that in with what the organisation's doing? Very complex ownership structure to that. It might sound really simple, but when you're delivering at pace, trying to work out the roles and responsibilities and the ownership of the risk, our Director of Public Health probably takes on that role. And so our Director of Public Health left the organisation and retired in February, and we were lucky enough to get another fantastic individual who joined us in February, and he brings a different appetite to risk, and he is incredibly measured and very well thought through. So the ownership and the appetite for risk changed slightly, and we had to adapt to that. So ownership of risk may be spread across certain organisations that don't necessarily come into the local authority family. So we might have other services that are being delivered on our behalf, and it's how we work with those organisations and the things we put in place to help with that consistency. And we've done a lot of work in that space, and it has helped that we have consistency through our organisation that helps us drive those conversations. Excuse me. So moving on to the next one, kind of stakeholder management. There wasn't really a strategy in place. We kind of knew who were the key players, but how did we, how do they consume information? Obviously, I've mentioned the hospital trust a little bit, and it was kind of like, well, how do we get somebody who's, dialing in, wearing full PPE, fully masked up, sitting basically in a broom cupboard in the hospital? How do we engage with them? How do we maximize their time? How do we make sure that we're providing that relevance of information that I mentioned before around the data that we're seeing and how they can drive what they need to do from a COVID outbreak management perspective within the hospital? So obviously numbers at hospitals across the country have been increasing and then have plateaued a little bit, and having a lockdown is a very, very blunt instrument of being able to stop transmission, whereas at the moment we don't have that. We have the vaccination program, and Torbay, which has an older demographic, is, I think, and don't quote me on this, I think it's about 89% or 90% of adults have been double vaccinated within Torbay. So we are seeing less admissions to hospital, but we are still seeing some. And some of the groups are starting to show signs of younger groups who are not vaccinated. So the hospital is working really hard to maintain not only their COVID requirements on the ward, but also how they still operate the emergency department, which is under stress, and having people in the emergency department staying there longer and needing beds, and also how they move patients around. So before, a few months ago, there was the option of using the Nightingale Hospital up at Exeter. That is now decommissioned. So the Peninsula work as a group to potentially move people around to help keep hospital wards open. And that leads to trying to keep elective surgeries happening. So it's about how do we engage with those people? How do we provide them with that information and that structure to help them making decisions? So we map those. We've got a plan in place to work with them, and we are constantly reviewing that. There's always seems to be somebody or another group which can help. For example, one of the examples was around COVID positive cases and how we would, if they were on holiday in Torbay, how we would get them home effectively. So taxi firms, how we would ensure that they were COVID compliant with all our risk assessments and all our things in place, and then how do we, engage with them when we've never really had to do that before. So they were kind of like, oh right, okay, that's an emerging thing for us, especially over the summer holidays. So we've been working on things like that, and it's constantly reviewing it. The one that's at the bottom is benefits, and this is the one thing that it has become really clear to me that it's really complex about articulating the benefits of a specific piece of work. And I've mentioned green spaces there. So I was on a call last week around a project for the BAME community around trying to encourage healthy fitness, well-being, etc. So there's a particular project that's been put in place around green spaces, but that's not the only measure that contribute to a successful outcome, hopefully. So there are lots of other outcomes and lots of other contributory factors. The weather, for example. We might try all the things in the world and have a green space and put in adult gym equipment and make it fantastic. If it's raining, the chances are. So it's hard to quantify that as a very black and white measure. And I think I've learned certainly over the last few weeks about how we can talk about realizing those benefits and showing the success and evaluating the success of certain projects based on multiple factors and not just one or two. So that's been a real key learning for me, actually, and I've enjoyed working in that space and working in the public health domain where that's not been my experience to date. So what does the future look like? So I have put with the team a lot of structures in place and a lot of consistency around reporting for projects. Like I say, using some of the existing stuff within the council, but weekly we've got we have a longer term program on a page where it's got a lot of information, but weekly we do financial reporting. We have a traffic light report and we collate that and look at trends, see what's happening, and we can in later, past March 2023, the council can still use that. It's still something that will be valuable, and how we then look to improve that. I've come from a kind of agile software development background, so doing retrospectives and challenging the value of meetings is always a popular one of mine. I'm sure the team I work with get sick of it, but it's about, is this meeting still valuable? What can we do differently? Do we need anything to pull it? So it's really trying to help instill that kind of thinking in the team that will be there long into the future. So we're putting those frameworks in place. We have capacity plans and resource plans in place. They go through our senior leadership team for approval longer term. Joining the public health team, it was very clear at a local authority that money is, such a key player, and money at the moment is not the blocker that it used to be. I'm not saying it fixes everything, but it helps enable, and it's a real mindset shift for people who have been working in an organisation such as a local authority, and I'm sure it's the same around the country, where every penny is, is vital. it's that mindset shift of, oh, actually money is not the first thing that's going to stop us. It could be time, it could be, you know, availability and all that stuff. So we've been putting plans in place for our resources, and we've got that mapped out for another 18 months or so. As I mentioned, I've come from like a software development background, so writing a test strategy was more around the testing pyramid and user interface and all that kind of stuff, whereas the testing strategy we've written early on in the year was around how are we going to do lateral flow device testing, what's our strategy, are we going to be mobile, are we going to be fixed site, and all that kind of stuff. So that's local to Torbay and how that best fits for our demographic. We've done a lot of work with Devon and the rest of the peninsula. Obviously, Devon have a larger geographic area, so their mobile option to get out to rural communities, get out to harder reach communities, was their first port of call. Whereas in Torbay, for those who don't know, there's 3 towns, Torquay, Payton and Brixham. You can get from one end of Torbay to the other on the worst case in about an hour, and it's very well served by public transport. So we had a fixed site for our asymptomatic testing in Payton, and now we've slowly moved to a mobile option. As I mentioned, an emergent issues paper, so we're constantly reviewing that, and we are adding to that at the moment. Obviously, with schools going back over the last week, we are sort of looking at the numbers, and testing has been at the forefront of what the schools are doing. So we are constantly reviewing our paper to take us into those, and looking at retrospectively, looking at data around peaks and troughs and what has worked over certain periods, and looking at trends to then plan up to March 23 and onwards. And a lot of that depends on the funding streams and the underpinning landscape of, you know, living with COVID, whether that becomes something that is remedied by having a booster or like a flu vaccination. And I think a lot of the people who work within public health have seen a change in emphasis. Like I mentioned at the start, when I joined Torbay Council's public health team, I made 3, so there's upwards of 20 now. I'm not suggesting that will remain at that kind of number, but it has, you know, changed a lot of the landscape about what public health means within a local authority. And our Director of Public Health is really keen to make sure we, you know, use some of the skills and the learning that we've come to over the last, however long it's been, 18 months. Last slide from me. You're probably pleased to hear. I think I hand back to Nina for open up to questions. Nina or Rob?
Yes, thanks, Alan. That was really interesting. I think we can all relate to having to adapt to an IT service, but at the pace and changing landscape that you've had in the health industry, I think that's phenomenal. That it all seemed to kind of, you know, must have been like a swan. It all looked great from the outside, but paddling like mad on the underneath.
Yeah.
You mentioned at pace quite a lot through that, and I was just wondering how much of the agile techniques that you used in your IT background were you able to bring in, and how would you recommend using them for others?
Yeah, it's interesting. Talking at pace, we got funding for a asymptomatic testing site and stood up a service within 3 weeks. So with the project manager I've been working with, he comes from a software development background as well. So we were using Trello boards. I know that's not like software development agile, but some of the techniques around tracking what outstanding work we had, reviewing at the start of the day. Some cases we were doing a checkpoint at lunchtime, and then in the evening, checking what we were doing. It was just really empowerment of me and the project manager, not kind of having sort of specific roles, if you see what I mean. It was more around, right, as a group, i.e. 2 of us, and linking into our public health team, how do we solve this problem? So we did bring some different kind of questions to it, probably some not relevant at all, and people were like, what are you talking about? But others were around, oh, okay, what if we were to do this? So we tried to keep it as flexible as possible. Some of the stuff, like I mentioned, around the tooling and, you know, sharing of information, and having worked at organizations that are self-sufficient and have teams that can deliver everything from a software perspective. So if you're talking about infrastructure and web development and testing all being in the same team, that's the one thing I did kind of apply at the public health team. So comms, for example, sat slightly outside of the core team. We brought them in, same with procurement, and not all at the same time. We don't all have to sit there. Everybody's really busy. It was like, right, we're going into a phase now where we think in the next couple of weeks we're going to need to rely on more procurement support. So we would bring them into the team. We have it's called a sit rep, but it's basically a stand up every morning with the team. We go through what we need to do that day, and then we go from there. So that's how it's more of the thinking rather than the tools and, you know, the absolute processes. I think asking validity of meetings was a key one, because, you know, I'm sure we've all been there where you think, oh, did I really get as much value out of an hour of my time? You know, so it's really just trying to make the most of that and not being afraid to be told, actually, that was a waste of time and we should do something differently. So those are the kind of, they're more behavioural, not, you know, kind of technology things.
Yeah, that's an interesting one. I'm sure we've all attended a meeting and thought, why am I here? So checking that's quite a good tip. And you mentioned like that you brought different people in with different skills at certain times, and we've got a question here. Excuse me. We've got a question that's saying how large was your initial team, and as it expanded, how did you handle that kind of increasing number of stakeholders and people that were getting involved?
Yeah, it's interesting. Like I mentioned, there were only a couple of people in public health when I started. How we've managed that, we've been very inclusive, and we haven't. So I'll use the example of local enhanced contact tracing. I mentioned about the 01803 number and that local kind of approach. Some other organisations who have massive, you know, we've got 137,000 residents in Torbay. You know, other areas have got that in one town or one city. So they've had a very much a call centre approach and almost like almost triaging stuff, and then they never really meet the team that they kind of hand stuff off to, and it's all done through a system called CTAS, which is great. But what we have done, because we're a small authority and we've got the ability to have a little bit more interaction, we have brought our local enhanced contact tracers into our team. They come to our stand up or sit rep on every morning, and they contribute to that. So we've really tried to include them in it. That's specific. If I was going to another authority in a larger council, that probably wouldn't work. So it's kind of that, what works for us. Oh, that seems to work. Okay, right, let's do that. And it's been the same with, you know, other areas of the organisation. So from a program management perspective, we've got a program board where we review finances, etc., and our program on a page. The next kind of step for us is the wider council IMT. So we look at housing, we look at across the board around traveller encampments and things like that. So we bring that, we get approval at that board to bring in resources as we need, and they're kind of an extension of our team. HR is another great example of that. So HR within the council have obviously various processes for recruitment. They've got frameworks around contractors and, you know, agency staff. and we work very closely with one or two HR representatives who are effectively embedded in our team, which just makes things, it just speeds up the process. We don't have to constantly go over why we're doing this. What is the need for this? It's like, oh, right, you're talking about you need 2 more people in your local contact tracers. Right, okay, I've got the job description. We went out before. I can get you somebody, to interview tomorrow, that kind of stuff.
Yeah, and I guess that speeds up the communications and helps with those management flows you mentioned as well.
Yeah, absolutely.
Yeah, so you've mentioned a framework that you put in place. One of the questions we've got here is, did you use MSP or did you use a different or what framework did you use?
Yeah, so it was based from an MSP perspective, but like I mentioned, it was hard to kind of look at the book and look at and then think, right, okay, this will work. So some of the things have been very light touch. Some of the things have not really been, appropriate for the time and situation. But yeah, always coming back to the MSP approach, and I'm always kind of sanity checking myself effectively. It's like, oh, hang on a minute, all right, what? And trying to zoom out a bit and just take out the immediacy and the kind of tactical feel to it, to try and help with the more strategic kind of framework approach.
Okay. So another question we've got is kind of, what was the biggest risk that you had to deal with, and how did you overcome it?
Oh, really good question. So one of the biggest risks, actually, and there were many, but having staff getting COVID was a real risk to us. So obviously not obviously, but we have been working at home. I've been into Torbay Council offices 3 times since October. I've never met my boss personally. So we've made sure that we've done risk assessments of when we're meeting and things like that. But one of the main things was, what would we do if capacity was reduced if people caught COVID? So again, with our testing staff, we had mitigations in place around, we would have people on standby. We did cross training. So for example, if the testing site was unavailable, we would be able to parachute people in to pick up that work and pick up that and facilitate testing to be taken place. Yeah, the capacity and the staffing was the big kind of risk. And one of the other things as well was, even so, for example, I've got a 9-year-old boy, having, when they went back to school and then getting a ping to say that he can't come into school, and how can I juggle my day job and looking after our son, especially in the early days when school provision wasn't quite as improved with online learning, etc. So to answer the question, I think the biggest risk was around people and capacity. Many others around financial risks and timely sort of financial reporting, etc. But the big one that cut through quite a lot of the stuff was actually the people-based stuff and how we got around it.
Yeah, I can imagine, particularly working with the people that were most at risk of actually contracting the illness. It must be really hard. I think we've all been worried, and having that work-life balance switching around is bad enough, but having to think about how people are reacting in their job as well.
Yeah, and from a public health perspective, that was challenging, but nothing compared to what the frontline hospital staff, and those issues still exist, and those risks are still very evident today. It's been a real challenge for them.
You've mentioned a plan on a page a few times, and we've had a request in of, would you be able to share that? Someone's quite interested in what that would be like.
Yeah, absolutely. It's it's one of those things that you need to find the cadence of when it is worthwhile updating and keeping things moving.
Mhm.
One of the things that has been so program. Well, I'm used to kind of program board monthly and etc. But we've been tactically meeting weekly because things have changed so often. So I zoom out a bit, and I've got a quarterly kind of plan on the page. But happy to share that. Absolutely.
I'm sure APM can facilitate that,
Cool. Yeah.
Claire. Okay. One last question is around the stakeholder groups. So you brought in lots of people and built up all these connections. Um, what are you taking away from that? Have you built up connections that you will continue to work with, or is that something that was just gone now and yeah, it was just for the time that was there?
No, I definitely think the kind of pathways have been established, and they might have been there in the past actually with something like previous infections. They might have had the same kind of links, but not, not as established as that. But yeah, definitely the work we've done around, especially around vaccinations with the clinical commissioning group, with the local NHS trust, we will definitely be using those. The links between the hospital and the public health in Torbay are really strong and are of great value. So definitely be looking to keep those going. Definitely.
Okay. Oh, we've got another question that's just come in. You mentioned you had an Agile background going into this program. What do you think was the biggest advantage of having that in your tool bag?
I think it gave me a bit of license to ask questions that probably were a bit noddy, to be honest, and were probably a bit like, "What's this guy talking about?" And just trying to, ask a few more kind of questions that might have been taken for granted, and just sort of asking that, and having that different approach to problem solving, and being able to sort of really try and eke out how you get to the root cause of something and how we do something about it. I found, so it was made incredibly easy by having a project manager that I recruited that had an Agile background as well. So we kind of speak the same language, but can apply it to the situation we're working in at the moment. So yeah, that was one of the key things, I think.
Mm-hmm. And I guess language comes into play quite a lot, particularly when you've got different stakeholder groups. So, yeah, being able to share common understanding is useful.
I very quickly had to Google what asymptomatic meant around testing. Like, what's that mean? Oh, goodness me, I should know that. And yeah, absolutely. And I'm sure in every organisation that the audience are in is around the jargon and acronyms. And for the first couple of weeks, it was like, humour me. Can you talk? Please try and cut down on the acronyms, which I've had at other organisations. So yeah, language is really key.
Yeah, I changed jobs in February, moved to a different sector, and it was completely different language, but it was still all acronyms. So yeah, I totally understand that, and I think we can all relate.
Yeah, absolutely. We even to the point of on our internal SharePoint site, for my own sanity, really, we've kind of got a kind of jargon buster glossary of what does this mean, and we're always adding to it and changing it. So it's useful, especially with people who might be new to the organisation, like bringing on board additional contact tracers. We had some that had worked in the call centre and done a little bit of public health stuff, but we've also had people who are blank pieces of paper, so we've had to help build their knowledge, and that really helps.
So a lot of things there. That sounds like it was a huge learning curve for quite a lot of people in your team and yourself. What's the one lesson that you're going to take away from this?
Good question. Hands, face, space is what I'm going to take away, I think. No, it's been a phenomenally positive experience, actually. The collaboration aspect is, I've been really lucky. I've worked at some great organisations, but the collaborative approach and all pulling in the same direction really helps with problem solving, with unblocking things, getting things done in a structured manner as well. it's not just been a free-for-all. So yeah, having that collaborative approach has been really, really nice, actually.
Thank you. So a lot of people saying thank you for your time and for such an interesting presentation. We can't clap on screen, unfortunately, but I'm sure everybody will be clapping at home. So thank you very much, Alan, and thank you everybody who's dialed in today.
Thanks, everybody.
We do have a couple of polls just to sort of capture kind of your thoughts from this evening's event, and also any topics that you may have for future events. The presentation has been recorded and will go onto the APM website along with Alan's slides. So thank you very much for logging in tonight, and we hope to see you at future events. Thank you, Alan.
Thanks, Nina. Cheers, everybody.